The treatment of metastatic colorectal cancer has been markedly changed over the last years. The main reason is that we have a much better understanding of the disease and of the molecular factors, which then also define treatment. For example, we have now the integration of immunotherapies into the standard of care in patients with metastatic colorectal cancer, as well as we can selectively target specific mutations which occur very rarely. If we think about the curative treatment, we have the situation that we can cure patients with localized disease, but we can also cure patients with metastatic disease if we are in the fortunate situation that we get a good control of the metastatic disease and then can also use local ablative treatment to destroy the remaining tumor. So overall, better medical treatment, as well as the early integration of surgery, as well as local ablative treatment strategies, widens the spectrum of treatment goals we can achieve. For patients with oligometastatic disease, to my knowledge, the ESMO guideline is the first guideline which uses the approach of using local ablative treatment strategy to enhance or endure efficacy of first-line treatment. So the guidelines do tell that if patients are under control with systemic disease, it might be a good idea to consider any local ablative treatment in the given situation. And any ablative treatment means the best treatment depending on the patient situation, depending on the status of the disease, on patient factors like comorbidity, and also on the treatment goal. So we have these different weapons. We can use medical treatment, we can use local ablative treatment, we can use radiotherapy and also surgery. But the knowledge about this is one thing. The best practice in a given patient case is the other thing. And this really means we have to openly and frankly discuss what are the treatment options likely at the best interest of the respective patient. And therefore, this means we have to sit together, or in the current pandemic situation, we have to video conference together to talk to each other and to know about the best goals, but also the limitations about our respective specialty. And only when we do this, we can really say that we are doing the best service. ECIO Congress has evolved as one of the major congresses in the global scale of oncology. We'll say we have learned that interventional techniques, that the usage of them and the integration into therapeutic algorithms has become a standard of care in many tumor types. And also research in this field is massively evolving. We have also learned that there are patient conditions and treatment conditions where we can identify patients which have the best interest in being treated with a local ablative treatment. And all of this is found and all of this is discussed in the various sessions at the ECIO Congress, in educational sessions, as well as in the rather research-based sessions, and also in the case discussion sessions where we learn about the best practice in applying the respective technique. So therefore, I think it's a good thing not to miss ECIO whenever you're interested, not only speaking as a medical oncologist in drug treatment, but also in the whole scale of using the best treatment options for patients with cancer.